This is Andrian.
And this is Ray. Welcome to the Talk Lab podcast.
Every 2 weeks, we'll invite a new guest and
In every session, we'll dig into their life, relationships, and perspectives.
one question at a time.
Let's Talk Lab!
Yay. Welcome to the Talk Lab podcast. This is Andrian.
This is Ray.
We've invited
Aileen.
together and we're going to do a second episode. And this time, we're going to talk about dentistry and how she got into it. Right, Ray?
Yeah, I think, so if you haven't watched part 1, you can learn more about Aileen, her upbringing. Yeah. So part 2, we're going to really focus on teeth. Teeth, yeah.
Everybody has teeth.
Yep. So Aileen, I think in this episode we really want to understand what makes you so interested about teeth and how you ended up the whole process of becoming a dentist. Because I think a lot of people don't really know the whole process of becoming a full-blown dentist. And now you're practicing for 1 year, right? And your whole education for dentistry or teeth is in Hong Kong. So briefly describe, this industry, your day-to-day job first as a dentist first. Then I think after that we can touch upon, why you decided to step into this industry.
Okay. So when I stepped into, the world of dentistry, I started with my undergraduate degree in Hong Kong U. It's a 6-year program, full-time, which is like 2 extra years compared to the normal degrees in any other university in Hong Kong. And the main difference about what we do on a day-to-day basis back in university is that we actually treat patients, where we have a teaching hospital and the patients come to us and then we treat them under the supervision of our clinical tutors, which are our teachers. And we actually learn and grow and, learn how to be a dentist through our patients and through, lectures. We have the normal lectures, we have the normal seminars, but it's also a lot about hand skills. So we practice a lot back then in the laboratories. We call it the simulation laboratories, where we have dummies. We do a lot of lab work as well, because actually when you talk about teeth, it's not just about the chair side, drilling, filling and billing the patient. We call it drill, fill and bill. It's a lot more about the thought process behind, I see Ray today here. I see that he has, say, problem A, and I always have to go back to the root of the problem. Why would Ray end up with problem A, for example? Yeah. So, that's all about the undergraduate career. It's long and it was a tiring, 6 years where it was kind of like a full-time job. We go to school from 9 to 6. Usually we'd leave the hospital when it was already dark outside. And that was me, running to Aberdeen for my Dragon Boat training 3 times a week after school ends. At the end of our studies, we passed our exams and then we are registered and qualified in Hong Kong to practice dentistry. And in my day-to-day life as a dentist, I have my patients that come in for their regular cleaning, their regular routine checkups, and, occasionally some fillings if they have cavities. But occasionally I also do get some emergency patients. When I say emergency, I mean they're in pain and they have a toothache that has kept them up the whole night. It's bothering them. They've taken painkillers, but the pain doesn't seem to go away. And it's down to me to find out the root cause of the problem and try to, give them emergency pain relief, be it is it an extraction or be it a root canal treatment. I'm not sure if you guys have heard of what a root canal treatment is.
No?
No?
I think my teeth are healthy, so. But I think we both have our dentist hats on to learn.
Yeah. So basically, what a root canal treatment is, within the heart of our teeth are the nerves, which we call the pulp, and the blood vessels. And sometimes when we have deep cavities that are too deep, that have gone in to invade the center part, or what we call the pulp of the tooth, the pulp becomes inflamed because the bacteria has entered it, and we need to do what we call a root canal treatment to try to clean out as best as possible the inflammation or the bacteria within the system, so that you don't feel the pain anymore. The reason why people have toothaches that usually keeps them up at night, it's a gnawing kind of pain, is because the pulp is generally inflamed.
Wow, sounds very painful because I know that I can relate to a bit of that. Like sometimes when you're eating cold food, right, then you get that sharp pain sometimes. I mean, I don't have that, but some people, they are very sensitive to that.
Yeah.
And I can just think of that, okay, amplify like 100 times.
Yeah.
That's really going
Yeah.
down to that thing. And I think these days, like, I think if you guys are interested in dentistry or anything, right, there's a lot of resources on YouTube out there. Like sometimes these kind of stuff get recommended to me. Like, oh, you know how doctor, like they film the whole process. Like there's dentists literally practice,
Yeah.
and then they show like, oh, the teeth looks normal. How there's actually a huge cavity underneath, and then they drill the whole way, and then they feel. Yeah, so I actually watched one of those videos, and then I think they start recommending a lot. I think it's very timely. We have that. Yeah, so yeah.
Actually, I think it's very important even if you don't have this problem, it's important to know a little bit about our oral health. We call it oral health education. And knowing more about these kind of things, even though you don't have the problem, it helps you to learn how to prevent these problems from happening. And that's a lot about that's kind of the mainstay of the entire dental industry right now. We're all about preventing problems before we come. We call it preventive dentistry. Back then, we'd be like, oh, there's a cavity, let's just fill it and bye-bye.
Yeah.
But right now, it's a lot more, and this is what I like to instill in my patients. It's a lot more about preventing a cavity from happening. And there are many ways in which we can do this. Say, for example, we start with the snacking, try to restrict the snacking. Don't snack too much because it's going to cause cavities. Brushing, how to floss, and the regular checkups. These are all very important and will help to prevent bigger problems in the future.
How often would you say 1 year? Because normally people would go 1 year once
6
per
months,
year.
right?
Yeah. Is it enough? And if you how do you take care of your teeth the best way? Even though you mentioned flossing, but how do you actually like maintain your teeth well for it to sustain?
Well, this could be a day-long lecture on how do you maintain your teeth. But let's start first with the regular checkups.
Yeah.
How often and should we get them,
Yeah.
right? I think I'd start with a benchmark of a regular checkup and cleaning, or what we call scaling, every 6 months. And this this time frame would go up and down depending on the patient's own risk. For example, risk of you having cavities, we call this caries risk, or risk of you developing periodontal disease, which is gum disease.
Yeah.
Have you guys heard of what gum disease is?
Gum, yes, but not that medical term.
Well, let's just call it gum disease. You know, when you don't clean your teeth well enough, your gums get kind of red, and you know, sometimes when you're brushing at night, you spit out and you say, "Oh, there's some blood in the sink." So that's kind of the inklings of gum disease. So based on these things, I recommend to the patient that, I'd like you to come in a little bit more frequent, just so that we can prevent or we can catch anything if it pops up.
Yeah.
Yeah.
But before you talk about other tips, I heard, because I think it's a very common thing that people know, is that if you do scaling too often, you remove the
Outer layer. So the outer layer, we call it enamel. And to be very honest, enamel is the hardest substance in our body. And usually when we scale, we don't aim to remove the enamel layer. We aim to remove the dirt, which we call plaque on the teeth. It's kind of a fuzzy kind of substance that you're supposed to brush away every night. We are also aiming to remove calculus, which is the hardened kind of plaque, which sticks to your teeth. Sometimes you see black stuff. We also aim to remove stains. So none of these, when we do the regular scaling, will we even touch the outer layer of enamel.
So it would be protected anyway.
Yeah.
So it's a common mistake that people would thought of. Like that's why they would like delay and not do a scaling process,
Correct.
basically.
Yeah.
So remember to do it because there are no risks related to that.
Yeah, I think we're all very fortunate. I think those young adults listening, or us, Andrew and myself, I think we just sort of got a free
consultation
from Dr. Aileen Loo. Yeah.
I told him I usually bill my patients XXXX figures.
Yeah. So I would say like I think most people they'll do it every 6 months, right? I mean that's
Yeah.
recommended.
Yeah.
For me, I just recently did it in Hong Kong. Yeah, because normally I do it back in Malaysia, and every year I'll fly back, right? So I'll do it like minimum once a year.
It's much cheaper in Malaysia, by the way.
Yeah, and I think we were also just sharing some of the experience. I can share more later, but I think yeah, just wanted to understand. Yeah, I think we already all bought in that. Okay, you are really the expert of teeth. Yeah, not surprising. Yeah, but then like we understand like okay, you went through all that training earlier, but what made you really want to stumble into that? I think now we can cover on that.
Yeah.
Your motivation.
Yep.
Was it your calling or it just stumbled upon? I mean, you try different things because you did mention that you had 101 diseases. So sort of like maybe I said it wrong. Like Aileen has a book when she was young.
She had 101 diseases.
Yeah, sorry, my
I
English.
sure hope I don't.
Yeah. So basically, she has a book that she'll list out the 101 diseases. So I think when she was young, she already had the
Interest, I would say.
interest
Yeah.
on medical field, right? But
Yeah.
can you just walk us through the young adults on how that thinking process? Because both your parents were lawyers, right? No one was in the medical field, yeah.
Yeah.
So
Yeah.
how did that interest spark?
When I was a teenager, I got my braces done, which is quite common for many teenagers these days. Back then, I had some crowding, which we call it, where teeth aren't in the right position because there's not enough space for them to grow. So the teeth get pushed forward slightly, and after I got my braces removed, I thought I had the perfect smile, and that's when I realized that I started to actually smile more. So it actually making my teeth or putting them in the right position with a good smile and a good what we call bite or occlusion. When you're able to chew well, you're able to talk well, you're able to smile confidently, is what brought out the confidence in me. And from there I started to really delve into think about studying about teeth. And like what Ray mentioned just now, I used to have a book and it was just about the 101 common diseases that we face, say, things like chickenpox and stuff like that. And when I tried to put these two things together, the medical field and teeth, I ended up with dentistry. So I think one of the things I did definitely think about being a doctor, typical Asian family, but I knew that being a doctor entailed long working hours and not really good work-life balance, and I knew that being an active person, I did not want that, and so that's where it led me to dentistry.
And you also had like a very personal life-changing experience, right? Like you sort of benefited from that whole process. So I think that was that was something I picked up on, that I think if you're a young adult, trying to think what interests you, you should also try to branch out into areas on what has impacted you in a positive way. And if you can think that you feel like this could be a possible career path, that's actually something very enjoyable, because you yourself, you're an advocate of that whole experience, and it will align to your identity. So don't just only think about the typical doctor, lawyers, or go to investment banking, consultancy, or startup. You want to start your own tech startup, but try to think. I think we covered a bit of that in episode 1, where you discuss about the advice that you will give to young adults is like, really find your why. It's a very tough question to answer, and there's no right or wrong, and it changes over time. That's the beauty of it. But you need to know at least what makes you happy, what makes you fulfilled as a start, and then you eventually find your why.
I think a lot of young adults, they haven't found their whys. That's why some of them are very clueless and just listen to, oh my god, other people are being an iBanker, I want to be an iBanker, but that's not necessarily what they enjoy. But then if money is what you really enjoy doing, I guess iBank is also a path. But then we always think that you should find your own path, or find what you enjoy and turn it into something that you can do as a career. It will motivate you in the long term, and not just in the short term. Money wise, it would be very, very great, but then in the long term, you may not even enjoy it. You're just doing a job that you feel dreadful about, but you want the money.
Yeah,
Right.
because for me, I really do enjoy caring for my patients as a whole. I like, and I'm actually, I feel very honored to care for them and their teeth, because the mouth or the oral cavity is something we use all the time.
Yeah.
Actually, even when we're sleeping, sometimes people grind their teeth. Yeah.
That's us.
Yeah, I don't know. I mean, it's a very, very common thing, actually. And so being able to care for such an important part of their body is I feel really, really happy to be able to do that for them. And that also inspires me to be a better dentist. So even though I've graduated, we always have what we call continuing education. So we constantly at the top
Yep.
of the latest technology and learning how to be
Yeah.
better to care for our patients.
You said you want to actually, before we're gonna jump a bit, you wanted to pursue like a further specialty, right? In terms of dentistry, what are there and what do you want to go into?
So just like doctors, where you have specialists in, say, for example, neurosurgery, you have specialists in orthopedics for the bones. For dentistry, we have a few specialties. I think about 7 of them in Hong Kong. We have specialists in gum disease. We call them periodontologists. We have specialists in oral surgery. We have specialists in pediatric surgery for children. We have specialists in prosthodontics, which are people who try to replace your missing teeth. Say, for example, you've got one tooth knocked out, and I want to be able to replace that for you, be it an implant or be it a denture. And that's for prosthodontists. We also have specialists in orthodontics, which is braces, like I got myself. We also have specialists in family dentistry, which is a person that takes care of your entire, well-being.
Yeah.
And lastly, the one that I'm interested in is in endodontology. Endo means inside, and inside means the inside of the tooth, which we've just covered just now, which is the heart, and the center, which is the pulp. So it has a lot to do with pain. Patients come to us a lot for pain, and patients come to us a lot for root canal treatments, and it goes on and on. Yeah. So that's a field that I'm quite interested in, and I do plan to pursue a postgraduate education in this, because this is the way a specialist becomes a specialist in Hong Kong. We do a postgraduate training in it, and then we do a further training, or we call it higher training, and finally it culminates with a specialist title.
How long would that take?
Ooh, it usually takes a minimum of 6 years after graduation. So it's a 6-year undergraduate course.
12 years.
Correct. Plus another minimum 6-year
years.
course. So like I said, we don't treat it as studying anymore. We treat it like we are learning. We are training to be even better for our patients.
Yeah, I think this skilled industry, especially like in the whole medical field, you really need to be very passionate to actually consistently learn and upskill yourself. Because from the experience of my dad, right? My dad's a doctor himself. He's a pediatrician. Yeah, so it's really a lifelong learning. Yeah, and you can see the difference between good doctors and great doctors. A lot of times, like, okay, they learn the basic thing and then they just kind of stick to the same practice unless they're forced to learn new things or the trends change. But I see like my dad, like every night, he just has this intrinsic value to like really learn about those cases. And even though it's not available in Malaysia, he is always finding books. And whenever he travels to a new country, he'll find medical books so that he get in touch
New
on the latest
knowledge.
cases.
Yeah, that's super admirable. Yeah.
And I think expanding on the point that Adrian have raised, right? You need, how long does it take? So before we dive into more details on the industry itself of dentistry, just want to understand from your side, like going through such a long course just to become a practitioner in that field. Did you actually like halfway in the middle felt like you wanted to quit? I don't think you felt that, but maybe like, can you just share, your whole experience, like considering it's 6 years, right? And most people graduate in 3 years or 4 years in Hong Kong, right? Yeah. Was there any like some trade-off or some sort of doubt or feelings?
When, because all the friends around me, they are usually doing a 4-year program. Like in most programs in Hong Kong U. Whereas mine was a 6-year program. So by the time I was in year 4, I still had 2 years to go. And there are my friends, starting to work, starting to being able to afford to buy themselves expensive things, being able to afford more expensive meals. And there I go, oh, I'm still on this sad student budget. At that point in time, it was again back to the reason why. Why am I doing this? And I knew that I had to persevere because being a doctor, being able to call myself a doctor, is not something that is given to you lightly. And patients actually trust you. They put their life or their mouth in your hands under your care. And it is this trust that you have to earn. So it is a long process, but it is rewarding at the end of the day. And, all I had to do was to work for another 2 more years and I would be a doctor. I'll be able to do what I like. I'll be able to earn money doing what I like, which is, I think, the most important thing at the end of the day.
I think to summarize, there are basically a few upsides of being a dentist. And because you really enjoy it as well, that's also one of the upside. What are the downsides? Do you think that there are downsides towards being a dentist?
I would say that some of the downsides are the long working hours. So for me, a normal day would start at 10 a.m. and it would end maybe 8. And if, for example, my last patient were to come late for the last appointment, it would overrun to easily 8:30. And that would be a 10 and a half working hour day. And I do work 6 days a week. In comparison to most people who work 5 days a week. And that's put together are quite long working hours. And, as dentists, we sit for a long period of time. So, you get the occasional neck pain, back pain, stuff like that. So, again, being active outside of work really helps to, maintain your body in tip-top condition for work.
Do you have...
No, I think it was good. Yeah, I was gonna ask like the upsides, downsides. Yeah, but I think you raised a point where you gotta earn the trust of the patients. I think and linking your why to during tough times, you always go back to your why, and then that gets you over. But are there any special benefits that when you go out and then you say like you're a dentist, do you get like special benefits on how people treat you? Because I know for doctors as a fact, right? Like, when you have doctor in front, you get sort of like more respected in society. Yeah, like, in Malaysia, just to give, because as a child, like my dad was a doctor, so I can share some stories. Like, for sometimes when you're driving, right? And then you hit like some issue, like you're speeding or something like that, some sort of like minor error when you're driving, right? And then the police will, hey, stop the car and everything. And then when they find out that you're a doctor, then they're more lenient, like, okay, next time I bring your kids, etc. And then they just like forgo you that.
Yeah, that's the side part about Malaysia that maybe Hong Kongers like Andrian would not really know about. We have, back path, sideways.
I mean, not to make Malaysia like. Maybe that was not the best example, but I think what I wanted to bring out, like, okay, when people know that you are a dentist that actually practice,
respect you more, right?
Yeah, did you get any like I don't know, like I wouldn't say special benefits, like how people actually
view you.
Yeah.
I think the profession of dentistry is very well respected in Hong Kong, and dentists, we also have the title of doctor in front of our name, and the minute people recognize that we are, she's a dentist, you get viewed in a somewhat higher social standing, which is very, very, very nice, actually. Yeah, but at the end of the day, we are, just the same as you all, just the same as the both of you. We are doing something that we like. We are just doing our best to care for our patients, and that's the most important thing at the end of the day.
Yeah, and maybe this is not really relevant to dentistry, but you mentioned a point that when everyone's graduating already, and then they could afford more expensive stuff. Yeah, and that's why that something that came out to mind, like, okay, personal finance is so important, right?
Yeah, I really enjoyed your episode on personal finance.
Yeah, so I think what is important is that you shouldn't compare where you are, because eventually everyone will get to the same place. It's just how much planning and what kind of lifestyle you want at the end. If you compare someone with a dentistry lifestyle, like, some of the doctors, they can, live quite a lavish life, and they deserve to, right?
Yeah.
Because they put in
Work for long
and
hours,
everything.
yeah.
But at the end of the day, depends what your end goal is, and you just backtrack and reverse engineer. There's always a way to get there. You just
Yeah.
have to put in the effort and have a plan to get you towards there.
Everybody has a different angle.
Yep.
Yeah.
Yeah. So
So I guess we touch upon the last point is, what's your next plan? Your next plan is to do a specialty, but are there anything on the future that you are on the lookout for, or you're gonna want to do?
I think I would not, there are always ideas floating around. I mean, it's not only about dentistry. I could have
Yeah.
other things outside of dentistry. But so far, having only worked 1 year in this industry, I think it's a little bit too early for me to say. I mean, there are always plans of, opening your own clinic
Yeah.
in the future. But, let's put that on hold until everything is a little bit more settled first. Yeah. At this point in time, not many solid plans. I just want to continue, being better and improving myself in this industry, which I'm still, to be honest, quite fresh in. Yeah. And starting out as a young adult, I think all of us can say, we're still figuring out what to do with our savings, what kind of investments to make. At the end of the day, we are not going to be wanting to work for every single penny we spend. We're going to be wanting that passive income, right? Yeah. So still figuring it out. Let's figure it out along the way together.
Yeah.
Yeah, and just to summarize on that note before we wrap things up, it's like, I think we definitely know that you sort of follow the path of like a dentist or a doctor where you need to specialize in an area. So that's another 6 years, right? Or like in parallel with your practice, and then off the side you have to also upskill.
Something like that. Yeah.
Okay. Yeah. So, and I really like the idea that, okay, you're not really setting your life as a path like a typical dentist, right? Because everyone, like, they just follow a path. Okay, they go specialized, and the whole life is maybe dentistry. What I picked out is like, maybe you are open to see if there's opportunities that come along the way. Like different type of industry, different type of experience that come based on the people that you meet. Then you will find something to do on the side too, etc.
I think the good thing about Malaysians is that we are very adaptable. I think Ray can attest to that. We are thrust into a different environment coming to Hong Kong, and we learn to adapt. Like, for example, the both of us, we came to Hong Kong with no knowledge of Cantonese. The only thing I knew about Hong Kong was it's busy, it's packed, and they like TVB here. And from
that's a sensitive topic.
that was back then, and now I know that Hong Kong is so much more than that. I've picked up the Cantonese as a language, and I'm able to converse fluently with my patients in Cantonese.
That's impressive.
And we adapt. So actually, it's not just Malaysians that nowadays young people, we have to adapt to be able to keep up.
Yep. Yeah, for sure. So I think is to wrap it up. So I think my last question is, where can we find Dr. Loo?
That's very important.
Yeah, that's very
I know
important.
that we all have free consultation
Yeah.
on what's the best practices.
But if you want a paid consultation, you can also visit her at.
Well, I do work in private practice. One of them is in Cheung Kwan O right now, and another one of them is in Kowloon. But usually we don't. It is, let's say, not that correct to advertise ourselves because it's part of the code of conduct in our dental council. And if you need to find out where we practice, on the Dental Council of Hong Kong's website, there's a list of dentists, and you'll find my practicing address there.
We'll put it right there. If I can edit it some way. Yeah.
Right, thanks so much, Aileen, for sharing about teeth.
Yeah,
the
thank
whole
you.
Industry.
Thank you so much for having me. I really enjoyed it.
Yeah.
Likewise.
Yeah. So thank you very much. If you like us, remember to like, share, subscribe, and share us on YouTube, Spotify, or other platforms. Thank you very much again, and thank you, Aileen, for being our guest today.
All right.
Thank you.
Bye-bye.
Bye.